Hi, I'm Krys Boyd, host of Think on KERA. Thank you for tuning in to tonight's special edition of the Dallas Fed's Global Perspective series. Over the next hour, we're going to talk about what the state of Texas needs to do to turn the tide against COVID-19. Joining me for this conversation are two leaders tasked with guiding the state through the economic downturn while also looking out for the health of those who live here. Marvin Odum served as chairman and president of Shell Oil Company from 2008 to 2016. In April, Houston Mayor Sylvester Turner named him the city's COVID-19 relief and recovery czar. Odum also spearheaded Houston's recovery from Hurricane Harvey. Robert S. Kaplan has served as president and CEO of the Federal Reserve Bank of Dallas since 2015. Gentlemen, welcome.
Thank you.
Thank you. It's good to be here.
And before we get started, we want to let those of you watching online know that we will be taking your questions as well during our conversation. You can email them to think@kera.org. All right, Rob, I want to start with you. Your counterpart at the Minneapolis Fed, Neel Kashkari, this week proposed a 6-week national lockdown. I see you smiling because I'm sure you knew I was going to ask about this.
I'm smiling because I'm glad to be here.
Oh, I'm thrilled to have you. 6-week national lockdown in order to get COVID-19 under control so that we can start to reopen the country and resume normal economic activity. What do you think of that idea?
So there may be situations in the United States where there's a threat that the healthcare system will be overwhelmed, where localities may have no choice but to shut down. But I personally don't think a hard lockdown for another 4 to 6 weeks is the right answer. And the reason for that is we had one earlier this year. Some may argue it should have lasted a couple of weeks longer till we got the incidence lower. But now that we're open again, my own view is economic view, that would cause the unemployment rate to spike back up again. Many small businesses I talked to, if there was a lockdown, they would be likely to throw in the towel and close permanently. And our studies have shown that the lower income workers, particularly Blacks and Hispanics, would be disproportionately affected by a lockdown. And even if after the lockdown, you'd have to follow healthcare protocols in a disciplined way to get the benefits of it. My own view is, based on talking to epidemiologists, if we had universal mask wearing and really adhered to it, we could mute the transmission of this disease very substantially. And in 4 to 8 weeks or 4 to 6 weeks, we would dramatically have reduced the transmission. And I think we're going to have to learn to live with this disease and stay open and manage it. And I think that's a better way to adhere to the healthcare protocols and stay open and try to preserve our economy. And I think we can reduce the incidence if we do that, but we've got to be more disciplined than we've been.
Marvin, city and county leaders in Houston and other parts of the state have repeatedly asked for permission to once again enforce more restrictions on activities and businesses than are currently allowed under state law. Governor Abbott says that's not necessary if everybody is wearing a mask to go about their daily activities. Are people wearing masks in Houston? And what can you tell us about the hospital capacity and the healthcare capacity in and around Houston at the moment?
Well, first of all, I think the strong messages around a mask mandate, something the city of Houston's done recently, which is actually to apply a fine now to that as well. They're all very important messages to say this is very, very serious, and we really need to follow these mandates, these guidelines, if we want to be successful in battling this disease. So I think any message, whether it's coming from the governor or from the mayor or our county officials, are critical to that point. And this is the one thing that everybody needs to absorb, is the tools to fight this virus are actually pretty simple. And, it's wearing a mask, it's keeping a distance, it's being smart about the idea that there could be virus in the atmosphere and just acting accordingly. And we just can't say it enough times those are the tools that we have to bring this disease back down to a level where we can effectively contain it. And that's how we win the marathon, is actually, working at that level of containment. And I think, as Rob said, that's likely to go on for a long time. What we're seeing here in the city of Houston and in Harris County, the larger metropolitan area, is, I think, and I'm going to qualify this, but I'll say encouragingly, a bend of the curve in terms of hospitalizations? Are we seeing our ICU COVID patients in the ICU come down? Now, I'll qualify that by saying this is all great. Number of daily cases is leveled out a bit. Problem is, it's still 10 times too high. So we have some serious work ahead of us. But you almost, if you look at the data and you look at the timing, you almost want to tie the mask mandate to some of these changes, because no, not everybody's wearing a mask, but the compliance with that request is much higher than it was before. And I'm starting to get more optimistic that we're actually seeing the effects of that. Now, the one thing I just want to say, not to make this too long, but I worry about giving messages like, okay, the curve is starting to bend. It looks like we're having an impact, because we do get the sense in a very real way, this is from talking to people, that tends to make them want to relax far too early. And that's why the still 10 times too high message is so important. We're starting to do more of the right things. We just need to do a lot more of it.
Rob, we have been distancing and restricting activities for 5 months now. What do you predict for the U.S. economy for the rest of 2020 and into 2021?
So we had as is well known, we had a substantial contraction in the second quarter, between 30 and 35% on an annualized basis contraction. We started to grow again in May and again in June. And we think for the third quarter, the annualized rate of growth is going to be as much as 20%. Now, those sound like just great numbers, but I'd put it in context. We're growing out of a pretty deep hole. We think we'll grow again in the fourth quarter, but we'll end the year with a contraction of about 4.5% to 5% and an unemployment rate that may be as high as 8 to 9%. I hope it's closer to 8%. But all of the progress and what I just described would go better if we had the virus under better control. And what we've seen is since mid-June, the rebound, while the numbers are strong out of a deep decline, the rebound has stalled a bit. So while I say we're going to grow at 20% in the third quarter, we would have grown even faster if we had adhered to the protocols more broadly and controlled the virus better. Going into 2021, then, we think we'll grow above trend, and I mean 3.5%, 4%, and we'll continue to drive down the unemployment rate in 2021. So we're going to grow from here. The only question is at what rate? And again, the better we control the virus, the faster we'll grow and the lower the unemployment rate.
So unemployment in Texas came in at 8.6% for July, which is more than twice what it was a year ago, but it's lower than the national rate of 10.2%. That's right. What is Texas doing right?
So I'd be the first to just caution, and while we're glad that it's 8.6%, these monthly numbers are a little bit idiosyncratic, so they can fluctuate a lot. So our guess is still Texas may well outperform the rest of the country, but the gap may not be as big as it looks. And some of it has to do with our mix of business here in this state. That I think we may have done a little better and lost somewhat fewer jobs on the margin. But I think we'll outperform the United States. But our guess is our recovery will pretty well track the U.S. recovery. Again, in mid-June, the Texas rebound is also stalled out. So I think you're going to see other states are doing a little bit better than us now because the virus incidence is lower. So that's another factor we'll just have to watch.
Marvin, you've done disaster recovery before for the city of Houston in 2017 after Hurricane Harvey. Very different kind of disaster. Can you talk about lessons learned from Harvey that are applicable here and things that really have no precedent that you're having to learn as you go?
Well, I think so think about this in terms of disaster recovery. I think what I learned during Harvey, and I've learned again now, is it's very important to start with a set of principles. So the primary purpose of a recovery team, if you will, response and recovery team, is setting the priorities and allocating resources. And to do that in a situation where you have more need than you have resources, you have to make some really tough choices. And so I think getting those principles set out at the beginning, was critical during Harvey, and it's critical here. And just to give you an example of that, three of those key principles for us are first of all, prioritizing our vulnerable population and communities. And it's a matter of getting very specific about that. We have 22 neighborhoods, communities in Houston that are particularly vulnerable. So that's where the first priority goes, is to make sure that we can take care of those people. The second piece is really around, as you spend money, and this was critical after Harvey, but I'm finding actually it is still very important here in responding to the virus, and that is, as you spend money and apply those resources, do it in the framework of resiliency, long-term resiliency. So if you have the opportunity to spend $1 that's going to make you more resilient in the future to other pandemics, other disasters, or what have you, then those dollars should get priority. It doesn't apply to every dollar that we spend, but think about something. I'll give you an example. Think about something like digital equity. Students, children, school-age children that have access to virtual learning capabilities. I mean, we were way short, as were most big communities, in terms of having all of our kids connected. Now, over the next couple of months, my expectation now, after the response to this virus, for what we've done in the region, with what the state is now doing in terms of funding, is that we will effectively accomplish that goal of having every student connected. And that means a tremendous amount of equipment that has to be bought, internet connections that have to be secured, data plans, and so forth. Big, complex picture. But we're doing this in a way that it would be resilient over time. So now think about the ability of a school that had to go virtual again 2 years from now. That capability exists. Think about that connectivity in a household. Now that household is more resilient because it has access to information on the internet and otherwise, telehealth, easier to find a job. I mean, it changes all kinds of things. So we give priority to those kind of dollars. And then a third principle would be something like coordination. Because of the breadth of the virus and this pandemic, everybody, of course, is in it. It's a cliche, but the idea that everybody is in it and we need everybody to respond is absolutely true. So the city doesn't work alone. The city works with the county, with the state, with our medical community, with our educational communities, with our business community, very much so, faith-based communities, and finding effective mechanisms to pull those groups together and work in a coordinated fashion is a big part of this response. It was important during Harvey. It's critical now. I think some of the key differences are what I just said, that this affects everyone. And, we had this strange sort of occurrence after Harvey. If you come into the city, it was devastating in the first couple of weeks. If you came in a month later, you could drive through the city and think everything was just fine. And it's a sort of a visual example of how some people were affected much more than others. And it tended to be the lower income communities, for lots of, sort of existing reasons, that were the most impacted. But it didn't necessarily affect everyone for a long period of time. So this is different. This does. And approaching it from that standpoint causes you to make different choices. Another key difference is that because of the CARES Act and the federal legislation and appropriation, there was money that came to the city of Houston immediately. So normally disaster recovery, it's not my favorite topic, by the way, but it's a long, very slow process. And a lot of that is the time it takes to get funding to the, on the ground to where it's really needed. When I came into this role in late April, there was already $405 million that had been allocated and delivered to the city of Houston to respond to this case. So having those dollars there and being able to respond quickly has been a very important aspect.
Rob, what kinds of additional fiscal support might be necessary to stabilize the economy and ensure that the recovery moves in a predictable fashion?
So extension of unemployment benefits is important. We've got approximately 16 million people in the United States who are out of work, but we likely have probably another 10 million who are working part-time because they can't get enough hours. They'd rather work full-time, and they're receiving benefits too. And so while the size of it and the mode may be restructured, We think extension of those benefits is critical for those families to be able to make ends meet and sustain themselves. And that's going to be important to the economy. And then the second priority I'd mention is state and local governments. While state and local governments have good liquidity, and we've got a program at the Fed to help ensure that, there's a big fiscal hole in most cities and states, and that their tax revenues fell off earlier this year, and they've got to balance their budgets. And most mayors I talk to and governors around the country tell me they've got to balance. They're going to cut in order to balance the budget, and if they don't get relief, they're going to cut back. At the same time, they're trying to spend on reopening schools and a whole range of other services to help the economy recover and fight the virus. And so when you're trying to dig out of a deep hole, you really don't want states and localities to be cutting back, but that's what we're going to have. So those would be two fiscal priorities I'd highlight.
Have a lot of states and local governments taken the Fed up on its offer of lending?
They haven't, and let me explain that though. Some of the Fed programs, and I'm actually actively involved in leadership of the Municipal Finance program. It's a $500 billion program, and just a tiny fraction has been taken up. But I think the program has been very effective, and I'll explain why. It's once we announced the program, we basically, in effect, provided a backstop to the entire muni market at rates above the market rates. But what that did is encourage private investors to pour money back into the muni market and back into muni ETFs and mutual funds. And we've seen a substantial rally in the municipal market. So there's been substantial issuance. It's just that the Fed rates are above the market rates. And so I think the Fed program has served its purpose. And I personally think the less take up from the Fed is not a bad thing. I think it's better to let the private market work, and I think that program helped ensure that the private market did work.
Marvin, you talked about 22 specific communities in and around Houston that you've identified as being especially vulnerable and in need of services. Can you talk about some of the existing problems in Houston that made those communities especially vulnerable at the moment the pandemic struck?
I will, Krys, but I wonder if first I could just say something about what Rob just said. I think I look at this a little bit differently right now. Most people would know me as a fiscal conservative, and huge appropriations, one after another. There's some concern there for me. But sitting at a city level now and looking at this and having a better understanding of what thin margins a city and probably most metropolitan cities operate under, as well as a lot of states, I'm convinced that some support from Congress on filling some of these gaps will actually be essential in having us move forward in the most productive way for the economy. So the kind of cutbacks that the city would have to implement if we can't fill that hole would be very detrimental to the process. So I just wanted to support Rob's comment on that point. I think the city of Houston, like most big metropolitan areas, suffered from a lot of, let's call them inequities before the virus hit. And what we've seen, of course, is even more exposure and exacerbating of some of those problems. And they fall into the categories which everybody's familiar with. It's access to healthcare, access to quality education, having enough affordable housing in the city. So all of those elements are at play here. And we're seeing, very big impacts on particular communities like the 22 that you mentioned that suffer particularly from those problems. We also have the attribute of having a very large undocumented population which comes with a particular set of challenges in terms of accessing help in a time like this and so forth. What dollars can actually go to that group of people? And then I'll throw one more in just to try to make it unique to Houston, and that is, post Harvey and post a number of flooding events, we have a pretty vast program going in terms of flooding infrastructure, trying to improve the status of the city from that perspective. And I think I mentioned before, when those events happen, they do disproportionately impact some of these communities, these vulnerable communities in our lower income parts of the city. So that's, if you will, a characterization of kind of what we were dealing with ahead of time. When you add in now a pandemic with just catastrophic job loss in the service sector, which impact those same communities, basically strip that income away to virtually zero. That's a devastating piece. These are also the same communities that don't have that immediate access to virtual learning and so forth. So when I say as a principle, we focus on these vulnerable communities, it's all of these reasons combined where, it's clear to the mayor and he sets the priorities. It's very clear to me that this is where the resources, to the extent they can be combined, need to go. And I'll just add one more piece, and that is that back to the point of we can't do this alone. This is not just a city response. And so we've created a group that we call the Health Equity Response Task Force. And this task force now, made up largely of city employees, coordinates with 50 community organizations, nonprofits, faith-based groups, medical groups, a number of them, to try to basically take a very holistic picture of how to provide these services to these specific neighborhoods. And I mean, there's tremendous work to be done, and I can find faults all along the way and gaps, but we are working very hard to solve those. And I think that sort of all community approach is the way we're going to address this in the best way possible.
So what do you do, Houston or any other city with a large undocumented population, folks who may not qualify for any kind of federal assistance, but their kids are still hungry, they have the same kinds of problems as their neighbors who have documentation. What do you do to serve them when they don't qualify for a lot of government-funded programs?
Well, it's just such an important program question, but I'll give you an example with a very specific program. So the increasing homelessness, evictions, very big problem for the community, very big problem in the undocumented community. Now, federal funds can't be used for that purpose for undocumented members of our community, but through private donations, organized in the right way, there's been enormous amounts of food distribution. We had a $15 million rent relief program about a month ago. Just to give you a sense of the need, it's not the best description, but to give you a sense of the need, we announced that program was coming out. Basically, the moment it became live, that $15 million was used up in small increments in 90 minutes. Wow. I mean, there's just an enormous need out there. So we're getting ready to start another $20 million rent relief program. $5 million of that, so a full quarter of that, is being funded through private resources, which then can be allocated to anyone in the community, those that wouldn't qualify for federal funds. So that's the way we try to, again, bring those partners together to try to be able to help the entire community.
Rob, are there practical limits
Krys,
to how much?
I might just have a little bit of a conversation here. Let me just comment a little bit just to emphasize one point Marvin made. What people know this who are listening, if you've got a college education or greater, it's very likely in this pandemic that you're able to work successfully remotely. Mm-hmm. And so you're able to keep working. If you've got a high school education or lower, work in the service sector, very likely, in person-to-person contact industry, you can't work remotely. And so we're finding in our work, those folks are being disproportionately affected by this pandemic. They're in the 22 communities that Marvin talked about, but this is different than prior recessions and prior downturns. The Great Recession that we suffered through 12 years ago had a broader, it disproportionately, it hurt low-income communities, but it hurt communities broadly. This one is a little bit different, and we've got to be very conscious of it. It's disproportionately affecting Blacks and Hispanics and at-risk communities, unlike other downturns that we've seen because of the nature of it. And this is why on the unemployment rate, I'm worried about in these communities that Marvin talked about, it's going to be harder unless we're able to manage the virus and reduce the incidence. It'll make it harder in those communities to get people who live there back to work. And so I'm very concerned about it, and it makes this again a different type of downturn.
So lots of people are. Please go ahead, Marvin.
Well, no, I just think it's such an important point, and And then taking that same, point of view from the recovery team perspective, what we find is that, so for example, educating on what needs to be done, mask distancing and the more complicated aspects of that, where to get tested, how often to get tested. It's not a matter of just broadcasting over television, right? Or over radio. It's not a matter of sort of standard social media. What we found is, particularly for some of these communities that are pretty wary of, connecting to resources and opportunities for obvious reasons, is this requires a tailored communication plan from people that are trusted in those communities, that are part of those communities, that are actually, using shoe leather, going door to door in some cases, putting door hangers on doors, conveying information that way, which sounds a little counterproductive in the middle of a pandemic, but we found it's absolutely necessary to get those messages to the right places.
So I might pose this to both of you. A lot of people are concerned about the disproportionate effects of the pandemic economically and from a health standpoint on Black and Brown communities in this country for moral and ethical reasons. For people who set that aside and are concerned only with the sort of broader overall economic impact on the country, why should they be concerned about the disproportionate effect that this pandemic is having on on folks who are already in underprivileged communities?
Okay, so let me start with that. The fastest growing demographic groups in Texas and in the United States are Blacks and Hispanics. And if they do better, we'll have faster workforce growth, we'll have better productivity, and we'll have better GDP growth. And so these communities being under particular duress hurts GDP growth for all of us. And this is why early childhood literacy, improving educational attainment, investing in skills training, improving Wi-Fi availability, which I think Marvin touched on, which is why they're having to go door to door. They may not have Wi-Fi. All these things are an investment in our country and in better GDP growth. GDP growth is made up of growth in the workforce plus growth in productivity. And if these groups are suffering, we're going to have slower workforce growth, lower productivity, and lower GDP growth at a time where I don't need to tell people the country is piling up debt. We've got very high leverage. We need faster growth to service this debt and to create a better country for our kids and our grandkids. So it affects all of us to see these groups do poorly, and will do better if we have more inclusive growth.
Well, I couldn't agree more. I think Rob's got it right on the mark. I think if I just added, the particular populations that you mentioned, how many essential roles they fill in our economy, in the service sector, as we talked about earlier. These are people we need in every respect. And I think that, I really have to start with the point that this is our community. I mean, this is us. And, it's just so clear from a city and greater metropolitan area perspective that if we're not all successful broadly as we move through this and move forward, it's just not going to work. And this, it gives me a chance to mention another program that is in place that I think goes directly to the question. And it's been something the mayor's been working on for quite a while. It's called Complete Communities. And so I go back to this neighborhood type approach, which again goes specific to the populations we're talking about. And it is about taking that comprehensive view of how do we provide the tools to that community, to those neighborhoods that allow that personal growth and that access to opportunities. And so that, thinking about that and moving that program forward in a very actionable way and funding that program where possible as part of this recovery, I think is the kind of thing that we have to get at to find a solution, because these are long-term systemic problems that need a solution.
How long will it be before the Texas economy reflects the expiration of those extra $600 a week in unemployment benefits?
If the benefits really are not extended, there are families right now, and I spend most of my weeks talking to small businesses, talking to people out of work. I talk to everybody. And I can tell you right now, there are families that are have already. I think the cutoff might have been a week earlier than the end of this last month, and there are already families that are facing severe stress if these benefits are not extended. So we're going to see real pain in the month of August, and I mean now. People have been waiting on these benefits as a lifeline. And again, it's not a small number of people. It's 16 million out of work, but there's another large group, probably 10 million people that are working part-time and they just can't get enough hours, and they're relying on these benefits. So you're going to see a real impact very soon if this goes on.
Has that money been a disincentive to people? Has it kept them from going back to work if their jobs still exist?
So I'll jump in, and then Marvin, I'm sure, has got views on this. Here's what I hear from, I must say, I hear from a number of businesses who've tried to hire people that they believe, on the one hand, they believe it is a disincentive, and they've said it's been hard to hire. On the other hand, our research has shown, not just Dallas Fed research, but broader research, that while that may be true in cases, the actual size of the benefits has improved consumer spending, which has added jobs in the economy. So the net effect has probably been to add jobs, but I think I do hear from businesses, I must acknowledge, that they think the size of the benefits has in some cases made it harder to hire people.
Yeah, I think I agree with what Rob said, but having sat down and looked at a lot of these people in the face, I think you can always find exceptions where somebody's basically taking advantage of the situation. And so undoubtedly there's a component of that. But I think more broadly speaking, this has been so helpful and so necessary. And it really helps me to hear Rob make the comment about the impact on the ongoing economy, not just those individuals. But as I apply this idea of this disappearing quickly to the vast number of pending evictions that will almost certainly go into play if that money goes away, that increase in homelessness at a time like this, when we're dealing with an issue like this pandemic, very negative outcome, I think. So we need to tread carefully in this area.
So Marvin talked about long-term investments, and one of those investments is in our human capital. And what we find is, if somebody's out of the workforce for a month or two, they can get back in. If they're out of the workforce for a more extended period of time, every study I've seen says it gets harder and harder and harder to get back in. If more small businesses fail, and they've got to get retrained for another job, it's going to take longer. And one of the things we saw on the positive side pre-pandemic was we had a hotter economy, hotter job workforce, more people getting in who hadn't been in and staying in. That really is a long-term benefit of the economy. And what's going on right now, if it continues too long, could do damage to the economy and to the workforce and to basically to the availability and ability of people to get back in and stay in the workforce. That could have a lasting negative effect. So we should be conscious of that.
What's the effect of all this been on the energy industry in Texas?
Go ahead, Rob.
Marvin knows this first. I'll let Marvin go first on this, and we do a lot of work on this, and I'll comment.
Yeah, and I'll appreciate hearing Rob's views. I mean, I spent a lot of decades in the business, and it's a business that is accustomed to big swings in commodity prices and impacts on the businesses. But this is clearly very devastating. You take a city like Houston, we're seeing it very directly in terms of a tremendous amount of job loss. I think from the perspective of a business, we're in a standpoint where cash is king, and depending on the strength of your balance sheet going into this downturn caused largely by the pandemic, will actually determine whether or not you survive as a company. So I think when I say cash is king, I mean virtually all discretionary spending is being cut. Costs are being cut everywhere possible, which means a lot of people losing their jobs. And it's basically a hunker down holding pattern for most companies in the energy industry until you can see the light at the end of the tunnel. Now, that does create a dynamic where some companies are in much better position than others. And so I think the entire industry is looking at what is it going to take for this to get back to a more normal position. What should be the right moves in terms of consolidations and dealing with bankruptcies during that time period, both of which I think we'll start to see more of. And if you think about it from the perspective of somebody like me who spent my time in large global integrated energy, it's not just this we're dealing with, this one swing in commodity price and this is a significant impact on the balance sheet. It's doing that in combination with what does an energy transition look like and where should companies be putting their money for the next couple of decades. Those are very difficult challenges for these companies, and everybody's working through that. But then also you have to consider this perspective, and I'd be interested in Rob's opinion on this one. We're going through a period of severe underinvestment. And this is not necessarily an industry that can turn production, despite all the conversation around shale and otherwise, where you can just turn production back on in large quantities to supply any demand out there in a short period of time. So we've been through actually, a better part of a half a decade of what I would call potentially underinvestment in the industry. And, if the economy comes roaring back, whether that's in late 21 or 22 or whenever it is, we have to have our eyes on, are we potentially dealing with a shortage for a period of time that could cause some different types of disruptions. But what do you think, Rob?
So let me give you the headline numbers to back up what Marvin said. Last year in the United States, we ended the year producing 12.8 million barrels a day of oil. It's our view at the Dallas Fed that we'll end the year closer to somewhere between 10 and 10.8 million barrels a day. So it's a pretty big decline. So where's that coming from? Number one, you've had about 2 million barrels a day shut in, meaning producing wells that literally stopped producing because the price was too low. We think by the end of the year, most of that 2 million will get reversed and restored. We'll still have a big decline, and to Marvin's point, the reason is you got a very big decline curve in the shale business. More than 50% in year one, and so unless you're investing a lot more regularly in new wells, there's a natural decline. So our productive output of oil in the United States is going to have a pretty significant decline this year. CapEx is dramatically down. Rig count is dramatically down. And it's our view next year when we talk to our contacts, it may not pick up that much. And so a lot of it is going to be a function of price. But we think by the middle of 2021, the excess supply that we had this big supply demand shock, and then you've had what OPEC started to produce, Saudi Arabia more. It'll take us till the middle of 2021 to work off that excess inventory. But by the second half of 2021, depending on growth, we'll be in balance. And so you could see prices, as Marvin said, start to firm up, $50 and above. But you can't just push a button. And the trauma of what's going on right now is causing a lot of workers who wanted to be in the industry to say, I don't want any part of this anymore. It's too volatile. And so we're seeing bankruptcies, restructurings going on right now, and much less investment, lower output. And we'll have to deal with that probably in the second half of 2021, where you start to see demand recovering. And so that's sort of the overview we see from the Dallas Fed.
I want to make sure we have an opportunity to work in some questions from people who are following along. We have one here. Market values keep rising. Is the Fed worried about another asset bubble given the 0% rate policy pushing investors into taking risks?
So one of the problems and challenges when you have a crisis like this, the Fed took bold action to stabilize financial markets and to inject liquidity into the system in order to help stabilize markets, but also stabilize the economy. One of the things you got to worry about then is whether that injection of liquidity and stabilization, you got to worry about the impact that has on risk assets. And so my own view is, at this stage, I think we have to be very cognizant regarding what we do from here. These special programs we've implemented to backstop corporate bonds and muni bonds and a whole series of public markets, I think they need to sunset. We have an expiration date which just got extended 12/31, but I think we need to say regularly they're going to sunset. And I think from here, as a member of the Federal Open Market Committee, I want to see restraint on what we do from here. Obviously, it's going to be a function of what happens with the virus, but I think that issue that your questioner raised is something on my mind that we need to be very cognizant of. It doesn't mean I would have done, I agree with everything we've done so far to deal with this crisis, but I think what we do from here is going to need to keep those issues in mind.
Another question, this one for Marvin. How much will working from home affect fuel prices?
I think it's a big question out there. I mean, just as an example, I was a frequent flyer to Europe for board meetings and everything else. I'm doing it all from here and doing it all from here very effectively, I think, for the most part. And so I think, one of the big uncertainties going forward is, as the economy comes back, what happens to things, close to me, like business travel, like consumers' sort of choices that they make, and how quickly will they feel comfortable getting back out into the economy. And, I really want to hear Rob's views on this too, because, I personally have my own predictions. I do look at it somewhat from a risk management standpoint. And my point of view from a risk management standpoint is I need to plan for longer, slower return, bigger impacts of the type of things like in the question than not. So I really only began looking at 2022 and beyond. But I think that's one of the big risk mysteries right now is what impact is this going to have on those typical consumption patterns and therefore energy or fuel. And it's not directly related to the question that was asked, but I also wonder, Rob, what's going to happen in terms of supply chain and how real that whole security of supply chain issue is. And over time, will countries and businesses start to pull things closer to home versus depending on a global economy? But
so we're seeing, as Marvin alluded to, we're seeing some changes in behavior. Some will be temporary, but some will be persistent, will stay with us. So one of the surprises that we've had here is when we look at gasoline demand and oil demand, it's been running about 90% of a year ago. I don't know that sounds high, right? I wouldn't have predicted that, but that is the case. So why is that happening? On the one hand, people are staying at home more and they're not driving to work. On the other hand, they're not using mass transit. Okay. So, and we know they're not flying. And if they're going to take a trip, they're going on driving trips more. And so I've been a little surprised. People are doing things remotely using the internet. And a lot of people who were saying, I'll never do that, I'm just going to go to the store, they've been forced to try it. And they realize, now I get why everybody's using, and they're going to act less. And as Marvin said, many of us travel for business and we're realizing, these virtual meetings, not bad, and you save a lot of wasted time. And so, and on supply chains, which Marvin was asked, you were seeing it even pre-pandemic, many people diversifying away from China, wanting to do certain things more here, have more control. The relationship with Mexico was changing, but very critical. But I think you'll see changes in all those areas. They might have happened anyhow, but this is going to accelerate them. And we're learning right now, and we're watching and learning. There'll be certain things that'll be temporary, but certain things we're going to have to adapt to. The economy and the structure of it and the way we behave is going to be different.
So does diversifying supply chains away from China mean a whole lot more manufacturing within the United States?
That would be the first instinct. My first instinct was yes. And after talking to businesses, my reaction is probably not. So what most businesses are telling me is no, not back in the United States. It's just, again, not. It probably means looking at other countries, some in Asia, but heavily taking a fresh look at Mexico, which is why that relationship is so important. But people are going to do whatever they need to do to be globally competitive. And by the way, our own analysis of the Dallas Fed is if they do it in Mexico and it stays in North America, that probably is, we should be thinking more and more about North America, Canada, Mexico, the United States as a block that gains share and was taking share from Asia and probably will take share from Asia if we manage it right. And so, but that kind of thinking, most businesses are relooking with a clean sheet of paper at all those questions.
Another audience question: large businesses with deep pockets seem stronger than ever right now, while face-to-face, in-person businesses are really struggling. This, I think, first to you, Marvin, is Houston's entrepreneurial culture at risk right now, and how can it be preserved?
Well, I think the entrepreneurial culture and that spirit, and that actually everybody's working very hard on building up some capacity all the way from knowledge to funding, will very much stay intact. I'm not particularly worried about that. But I think the premise of the question around small businesses, I am extremely concerned about. So I think anything that we can do, from a federal government on down standpoint, to help these small businesses get through this just devastating initial impact, I think is really key. And I know you're going to get tired of me doing this, but I'm going to keep bringing it back down to a very granular level. When we think about the success and the long-term viability of some of these smaller communities that are in difficult shape, some of our funding to small businesses will go to those essential services, restaurant, food services, others in these communities to help them survive. And that won't, in any near-term fashion, move the needle at all for a city like the city of Houston. But it's absolutely essential for the survival and well-being of that neighborhood, right? So I think there's just so many levels at which you can look at this kind of question.
So on that, it's a reality that there's no question what you said is correct. Small businesses have less access to capital. They can't access the public markets. If they're in the person-to-person contact industry, they may be finding it hard to get a loan. That's why PPP was so important. But there were other trends even pre-pandemic. This is accelerating. What's an example? Our own analysis was we were probably overstored with retail stores in the United States pre-pandemic. We have more retail per capita than most other countries do. That was probably going to affect malls and other retail spaces. This has now accelerated that. And you're going to see a lot of, you're going to see more, I would guess, when we look back 2 years from now, physical retail per capita is going to be a lot less than it was pre-pandemic. And this will be, and most of those, much of that retail, some of them are chains, but some of them are small businesses. And so you're going to see real effects here that might have happened anyhow, but this has sped them up.
So how can we make decisions about, I mean, it's cold comfort if you work at Foot Locker or a small business like that in your local mall, and that is your job. How can we make sort of collective decisions about which businesses and kinds of businesses should receive help to keep going, and which ones are perhaps the continuation of a trend that had already happened, but, involve real human beings with lives and jobs attached?
So here's the challenge, and I guess I always knew this, but I really learned it in earnest at the Fed, in that millions of jobs every year are destroyed in the United States, okay? And then millions new jobs are created. There's a capitalist process, and so I could see where there's a point of view that, and my own point of view, having been in this job, is rather than decide who wins and who loses, and other than giving, I think the PPP was a good program, but ultimately this gets down to labor force adaptability. There's going to be plenty of capital, and is plenty of capital, for new businesses to start. What I worry about much more is especially high school or less educated workers, which, by the way, are a 46 million workers out of 160 million person workforce, very large. The capitalism will work. I don't worry about that. I worry about how adaptable those 46 million workers will be and how long will it take many of them to get from the current job to the next job. So that's why we've been talking a lot even before the pandemic, and I would talk even more now about early childhood literacy, improving educational attainment, and beefing up and really investing in skills training locally. We've got to help the workforce be more adaptable. I don't think you're ever going to have a passion in the United States to pick winners and losers, but I think we should have a passion to invest much more in our human capital so they can adapt much more successfully to capitalism.
Krys, I just want to support exactly what Rob said. I think that is right on the mark. I think I'll just take a slightly additional point of view in terms of from a public standpoint, and again, in this case, the city of Houston. I think to some of the systemic issues Rob was just getting to, a program like Complete Communities is built around trying to improve that over time. But what I could see us doing from a small business standpoint right now, not picking winners and losers, but providing small business grants to those essential businesses that I mentioned in those communities to try to bridge the gap, to give them an opportunity to survive so that they can then go back to competing just like everybody else. I do think there's a role here for the public entity in doing that.
I know that Houston ISD, like a lot of districts around the state, is pushing back the start of school, and I think we'll start virtually and then hopefully have in-person classes. There is still a huge burden on working parents for whom school is an opportunity to educate their children and also a safe place for their children to be all day while they do their work. What's the economic impact, whether we can help it or not, of parents trying to somehow have their kids at home and also either go to work or work from home? I mean, how much productivity are we losing because of the situation we're in?
What do you think, Rob?
Well, unfortunately, we'll get back to what we were talking about. If you've got a college education or greater or better, you could probably manage this because there's a good chance you're going to be able to work remotely. If you've got a high school education or less and have to go to work, you can't work remotely. This is an enormous problem. And so this is why everybody, on the one hand, everybody wants schools to reopen. On the other hand, what you don't want to do is have schools reopen and have infections of the virus and then spread them broader to these communities. And so it is really a challenging issue, and it would all be easier if we all, from now until when school started, wore masks. That's the only thing I know to say is we've got to get the incidence lower, because we've made the job of the school administrators and the people who run these schools extremely difficult when the incidents in the communities are this high. But to your point, it will hurt the economy. But what's the answer? You still got to manage the virus and do things that will be responsible. But you are right, disproportionately lower income and lower educated parents will be disproportionately hurt by the inability to get kids back in person in school. But yet the schools and the communities need to want to balance the health risk with having them in person. So this is just a agonizing dilemma we're going to work our way through.
And Krys, I'm gonna cheat a little bit on this one because I think it's a great question and I find it almost impossible to answer. I mean, I just don't know how to measure that sort of impact, even though we can already feel how real it is in the community. So I'll punt back to the question and somewhat aligned with what Rob was saying, which is it's all about getting the community healthy so the schools can open. So that solves the problem as quickly as possible. And we're very much trying to turn the attention, for so long, our attention in the city and I think broadly across the country was around hospital capacity and where we're going to bump up against that limited hospital capacity. And, Houston is absolutely blessed with a tremendous capacity in the healthcare system. And when it was pretty clear that we weren't going to, most likely, then I think people just relaxed way too much. So we're trying to shift away from that as the measure, and to think about, still measures, still technical, but to try to get people oriented around positivity rate, an indication of how much infection there is out there in the system, the number of new daily cases that are being identified, and this R naught measure, which is basically the reproductive rate of the virus, to focus on what the acceptable levels of those three measures are. And maybe, and hopefully, to use school reopening as the convening rallying call for get these measures to this level by doing what Rob said, wearing the mask and doing the obvious things. That's how we solve these kind of problems. And so we're trying that shift now, and I hope it has the right impact.
Here's another audience question that I love because I really think it asks for analysis and not political opinion. Can you compare how a Trump win in November versus a Biden win in November would affect the economy post-election? What can we predict about one or the other and how things might play out?
So it's not going to surprise you, Krys. I'm not going to go within 1,000 miles of that, the way it was phrased, but I'll say the following. The critical path for the economy, and frankly, the reason why we called you and we want to do this session tonight, and I wanted Marvin on and talk about this, the critical path is how will we manage the virus. While monetary policy is very important, and I'm a central banker, I'd like to think it's the most important thing. It's not. Fiscal policy is important, but it's not the most important thing. Does everyone listening tonight wear a mask? Do we all band together and say we're gonna unite? And do things that are uncomfortable and wear a mask every day to the extent humanly possible and mute the transmission of this virus. And I still think that is the dominant determinant of how the economy is going to do this year and next year will be how well we manage the virus. That is the primary economic tool. This mask, I'm sitting here, is the primary economic tool, in my view, we have right now to fight the virus, but to grow the economy.
Couldn't agree more with what Rob said. But after we pass that threshold of we're managing the pandemic in an acceptable way, and that's not the predominant factor anymore, I really do sincerely take a pretty neutral role, meaning there will be differences, I'm sure, and different investment choices made and different investment places, but there is a lot of drive to make a lot of things happen, and I think it happens in either scenario. So that's my personal point of view.
Okay, we'll move on from this.
Thank you.
So, Marvin, you've said the words 2022 a couple of times. We're all hoping that an effective vaccine will be found. The White House has invested, I think it's $12 billion in vaccine development. There are a handful that are in stage 3 clinical trials, but we really don't know how that's going to happen. Do we simply need to be planning for this as if COVID-19 is a somewhat medium to long-term issue for the United States, both socially and economically?
Yeah, well, once again, I think the cliche is true. This is a marathon, and the definition in this case of a successful marathon is we get this disease spread back down to a level where it can be contained effectively. So through testing and contact tracing, you can manage the spread of the virus. And that's the successful case for us, because we will likely live with this for quite a while. And, I would love to see a vaccine, of course, we all would, come into play by the end of the year, let's say. But, one of the opportunities in this role has been to listen to a number of experts and an amazing health community there in Houston. And when you start to translate that, having an effective vaccine into manufacturing the doses, into distributing and administering those, and then dealing with probability success for various individuals, this is a long path. I'm not finding anything that says we should take a point of view other than we're going to live with it for a long time. The tools we have to get it under control are pretty straightforward. It just requires people to do the right thing. And that's the way we ought to look at it.
And I agree with everything Marvin said. Even with a vaccine by December or January, it's my own view that we're going to spend much of 2021 having to wear masks, socially distance, because the adoption rate of the vaccine and before it gets the whole population, this is in the best case, it's going to take most of the year. And so this is a virus we're going to have to learn to manage and live with. And I think we can. And I'm optimistic that we can.
Robert S. Kaplan has served as president and CEO of the Federal Reserve Bank of Dallas since 2015. Marvin Odum is Houston City COVID-19 Relief and Recovery Czar, former chairman and president of Shell Oil. Gentlemen, thank you so much for the conversation.
Thank you.
Thank you, Krys.
Thank
Thanks,
you.
Rob.
And
Thank
you can hear an edited version of tonight's conversation tomorrow at noon during Think's program on KERA 90.1 in Dallas. Again, I'm Krys Boyd. Thanks for listening. Have a great evening.